This is When Science Speaks, a new web series profiling innovative and interesting people working in science and technical fields, from academia to industry to the nonprofit world. We explore how to be a powerhouse advocate for science and your research, how to advance your career in meaningful ways that make you happy, and how to push back on the ongoing assault on science and other related issues of interest happening in the world.
Well, hey everyone, it's Mark Bayer, and you are tuned to When Science Speaks. Thank you so much for being here. Today's episode is brought to you by Bayer Strategic Consulting, a unique training and advocacy firm in Washington, D.C. that helps scientists and engineers get funding, advance their careers, and build key relationships with their most important stakeholders. To get bonus content and useful resources, you can become a friend of the show. All you need to do is text Science Speak to 44222. It is wonderful to have Dr. Joe Shrand on the show today. Joe is a psychiatrist who works with adults as well as with children and adolescents. After a career in theater, he went to medical school, and he's now board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. Joe's an instructor of psychiatry at Harvard Medical School, chief medical officer at Riverside Community Care, which is in Dedham, Massachusetts. He's founder and president of Drugstory Theater, as well as a published and award-winning author of several thought-provoking and innovative books, which we are going to get to in just a moment. Welcome to the show, Joe. Thank you so much for being here.
Thanks so much for having me, Mark. Really appreciate it.
You know, you don't often see a theater to medical school transition. So I have to start by asking you about that. What led you to get interested in medicine? What maybe get interested in theater to start with, and then some follow-ups after that.
Absolutely. Well, part of it, Mark, was really my upbringing. My mother was an actress, Frances Shrand of the Spider's Web, WGBH in Boston, and my father was a pediatrician who was chief of pediatrics for Mount Auburn Hospital. So really, those were the only two things I knew how to do. So I started off, though, you may remember a TV show called Zoom.
Absolutely.
Which was out of WGBH here in Boston. It was a national program. It taught me a lesson. Let me just back up and tell you a little bit of the story about how I got into Zoom. I had already started to do some theater in the Boston area. I had moved here from England and was doing theater, playing the role of Artful Dodger in a touring production of Oliver. And a friend of mine had come to see it. I think I was like 6th or 7th grade. He and I wrote a play while we were in school about Sherlock Holmes, and the entire play revolved around Sherlock Holmes saying, "Please don't call me Shirley." It was terrible. His mom found out about some auditions for this new kids TV show. Neither of us knew anything about it, so we went to the audition. We did our terrible play, "Please Don't Call Me Shirley," and then this fellow with a British accent, I also had a British accent at the time, he said, "Can either of you sing?" And because my friend had seen me in Oliver, he said, "Well, Joe can sing." So they separated us. I went into one room and started singing, then started doing improv, started just hanging out with these folks. And I got a phone call that night from this fellow with a British accent. Turned out it was Christopher Sarson, and he said, "Would you like to come back for the callbacks?" So I said, "Love to." I called Timmy and I said, "Whose mom is going to drive, your mom or my mom?" And he said, "Drive where?" And I learned my first rule of acting, Mark: never bring a friend to an audition. And then that was it. I got on Zoom, did a lot of theater, had a small theater company up here in Boston after I graduated from Sarah Lawrence. But before that, I had taken my junior year and gone to Harvard to study sociobiology. This is a very long story for your short question. But while I'm saying that, let me just say I'm a psychiatrist. And so psychiatrists, we usually listen. So when we do get a chance to talk, sometimes we just keep going.
No, this is really interesting. Go ahead, Joe.
Okay, so when I was at Harvard, I was studying sociobiology, which is the genetics of behavior. I got really, really interested in this idea that we are driven to perform certain things. We're always trying to survive. We're trying to do the best we can. We might not always get it right. That became a foundation for many other things that we'll talk about. Went back to Sarah Lawrence, did more theater, had a theater company after school, went back to New York, and I worked as a writer for CARE, which is the International Aid and Development Organization, and I was a fundraiser for them. Got a lot of money for CARE from a group called Rotary International for a program down in Central America. Went down to Central America to see what I was going to be reporting on, and realized as I was watching all these people being helped that I was doing medicine wholesale. I was helping people that I would never be absolutely, one-to-one contact with. And I decided I wanted to do medicine retail. I wanted to be the person in the room. So I went to do my pre-med at Columbia, then came back up to Massachusetts, worked in the lab, finished my pre-med stuff at Harvard Extension School, and then wound up going to University of Cincinnati College of Medicine, and got just fascinated by psychiatry and then child psychiatry. And I began to really wonder about the sociobiology and about, I'd also been studying Zen Buddhism at the same time, and these things started merging into something that I created in 1982 before I even got to medical school, called the I Am approach. So let me just pause for a moment. In 1982, when I took my pre-med, I had to take physics. Audience, are you still awake? Because whenever I say physics, people immediately fall asleep. But just bear with me for a moment. In physics, the symbol capital I stands for potential current. And I thought, well, why don't we just flip it upside down and we call it a current potential? And what if we start looking at everyone at a maximum current potential, simply doing the best they can at this moment in time with the potential to change in the very next second to another best they can. And that has absolutely been the foundation of everything that I have done in medicine. The I Am approach. And we can certainly talk more about that.
Sure. Yeah, it was physics that led you to that approach, which is just so interesting to me as someone who dreaded physics junior year in high school at Framingham North High School. But I want to ask you, we're going to get to the I Am approach, so central and important. Before we do that, I would love you to tell listeners about the Drug Story Theater and your work there, how it came to be, and what the focus is with Drug Story Theater.
I would be delighted. So Drug Story Theater is the synthesis of my theater experience and my medical experience. What we do is we take teenagers in the early stages of recovery, we teach them improvisational theater, and then we use psychodrama, and they create their own scripted shows about the seduction of, addiction to, and recovery from drugs and alcohol. So the treatment of one becomes the prevention of many. That's what we want to do. We want to help other kids never go down that pathway that our kids did. But in between each scene of the show, the kids step out of character and they do PowerPoint presentations teaching the audience about the neuroscience of adolescent brain development and why their brains are at such risk for lifelong addiction. All the kids in the audience take a pre-show neuroscience quiz, and then they take the same quiz after the show, and we're looking at how kids who learn about their brain change their perception. We're not trying to scare them. This isn't a program where we're saying, don't do drugs, don't do drugs. What we're doing is saying, based on the way the brain is developing, your brain as an adolescent is at risk. Here are the numbers. If you start using drugs or alcohol after the age of 21, 1 out of 25 people are at risk for lifelong addiction. So that's during the PowerPoint. A big slide comes up. 1 out of 25 are at risk. And then the slide says, but if you start using before the age of 18, that number goes from 1 in 25 to, and a slide comes up, says, guess here. Mm-hmm. And I just want you to sort of imagine an auditorium of 800 6th, 7th, and 8th graders beginning to shout out numbers. Guess here, this number, that number, this number. And somebody always will say, just randomly, 4. And we'll say, you're right. Slide comes up, you're right. Think about this, Mark. You start using after the age of 21, 1 in 25 people at risk for lifelong addiction. You start using before the age of 18, that number goes from 1 in 25 to 1 in 4, just because the way the brain is developing. Mm-hmm. We are teaching that addiction is not about morality, it's about mortality. It's just the way the brain develops. And so we'll have this auditorium of 800 kids. After the show, there's a talk back. Mm-hmm. The kids in the audience ask our kids questions. And during that, I'll say, okay, let's just have 200 kids stand up. And we pick, this section of the theater. 200 kids standing up in an audience of 800. And we'll say, that's how many of you are at risk for lifelong addiction right now, just because the way your brain is developing. So all we're asking you to do is wait. We would prefer it if you never used, but if you are going to use, please wait until your brain is a little more developed and decrease your risk of lifelong addiction.
Yeah, so powerful.
That's the message.
Yeah, so powerful. And, one thing I love about it is, like you said, it's not a don't do drugs message. Listeners of the show will remember that I had Dr. Jonah Berger, who's a marketing professor at Wharton School at UPenn, and he talked about the Truth campaign, the anti-tobacco campaign that was wildly successful, actually probably the only one that's really made an impact of that magnitude. And it was very much about sharing the truth, the information, just like you did, instead of saying, just say no, which of course was the Reagan administration's response back in the day for people who remember that. It just does not work. Not about morality. I love that. It's not about morality. It's about biology. Right. It's just the way, like you said, the way things are, where your brain is developing at that point in your life.
Yeah. And again, that's why I'm so appreciative to be on Science Speaks, because we have to be able to translate hardcore neuroscience and message it in a way that people can go, whoa, I understand that, never realized that. That's really what drug-story theater does. So drug-story theater takes this theater experience that I've had in the past and my psychiatry experience working with teenagers struggling with substance use, and we get to create this thing. And I'm telling you, for the kids who are doing it, my drug-story theater troupe, it is mind-blowing what they can tell you about it. They are the people who other kids listen to, not some white-haired old psychiatrist like me. It's that peer-to-peer. It's the honesty of it.
Right.
That's amazing. And that's the coolest thing, because what we know is that one of the great risk factors for first-time substance use is low self-esteem. Every one of the kids that we've had in our show has struggled with that. They didn't feel they were good enough. They weren't strong enough, bright enough, whatever it was. Their self-esteem was hurting. And so the only pleasure they could feel was doing drugs. Totally different chemical in the brain, dopamine.
Right.
But what we teach the kids in the audience is you can always remind someone of their value. And whenever you remind someone of their value, you increase your own value. And so we'll have 800 kids. We'll say, okay, just for the next minute, just whoever's sitting closest to you, just say something nice about them. And the room explodes in laughter and the silliness. And we calm everyone down. We say, is anybody here not smiling? And everyone's smiling.
Of course.
I mean, look, Mark, you're laughing just listening.
Yeah,
I
can
right?
see it. I can see it.
Right. And we say that's peer pressure. But that's positive peer pressure. That's helping somebody else, never go down the road. And when you, the audience, stand and applaud our kids on stage, you are reminding them of their value. And that's their treatment. The treatment of one becomes a prevention of many. You, the audience, are involved in helping these kids up on stage live a different life, a quality of life that has nothing to do with drugs or alcohol anymore. It's powerful. It's so simple.
Absolutely. It's a virtuous circle. I mean, you're really, like you said, the performers are getting this benefit, and obviously the audience as well. And you're combining the right message, as we just referenced, and also the right messengers, as you said. And that is such a unbeatable combination when you can do that and find the right message and then the right people to deliver it. I just think it's fantastic. Absolutely. And I'm sure the results that you get from that are just, so impressive to be able to see the change that the theater has been able to affect. Maybe you could tell us a little bit about the beginnings of the theater and so forth, and how it's operating. Obviously, today we're in a very different situation with the pandemic, but just some background on what led you to come up with it and how long it's been going on.
So I had started an adolescent residential program back in 2008 and realized that one way that we could help these kids was to remind them of their value. Every single person in the world wants the same thing, which is simply to feel valued by another person.
Right.
I mean, really, Mark, just think about every person you've ever met. On some profound level, that's what we all want. And we began to start doing some psychodrama, which is a remarkable therapeutic tool. One kid will tell their story, and then they become the director, and the other kids in the group enact the story. It is a powerful modality. And then in 2010, my eldest daughter, Sophie, was getting her degrees at Northeastern in she was getting it in behavioral medicine and behavioral neuroscience and theater. What a coincidence. Behavioral neuroscience and theater. And she and I started doing this literature search, and she found for her senior paper that the scare tactics in stopping kids from using drugs really didn't work.
Right.
She was also into theater. I'm into theater. We had this idea of drug story theater. Everybody has a drug story, but story theater was a play that I was in high school, which was about Aesop's fables, where they took the fables and they made them into a play. So that's why I came up with drug story theater. In around 2014, we got funding for the first round of drug story theater from State Senator DiMacedo. He's now at Bridgewater College. And that began the pathway. And we began recruiting kids from our program at Castle and then in other outpatient programs. But what we also were doing was realizing that all drugs and alcohol force your brain to make dopamine, but there's another chemical of pleasure. It's called oxytocin, not OxyContin, oxytocin, which is the feeling you get when somebody says, Mark, when science speaks, it's the best show I've ever heard, and you get this rush. That's oxytocin. What we learned was that dopamine interferes with oxytocin. All drugs and alcohol force the brain to make dopamine. It interferes with the neurohormone of trust. And that's one of the messages that we give the kids. You can get high, but the price you pay is trust. You just decide which pleasure is more important to you. So Drug Story Theater then started getting funding. I have an incredible team behind me, Kathleen Wright, Nicole Conlon. They help organize this. And we have now performed for over 40,000 kids in Massachusetts.
Unbelievable.
We have incredible data that shows how kids learn about their brain. But because of COVID, we had to stop going into schools. But we had already made a video of one of our shows. We've got a middle school show and a high school show. We had the middle school show ready to go, and we got funding from our district attorney, Tim Cruz. And now every single middle schooler in the Plymouth County has access to the video Drugs-Free Theater. So we can continue to work with the kids in the treatment of one becomes a prevention of many, even though we're doing COVID.
Sure.
And that's one of my phrases. Adaptation is innovation. Adaptation is innovation. And we've all been struggling with COVID, but we kept going with Drugs-Free Theater. You can find us on the web, drugstorytheater.org, and that's theater with an ER, because so many of our kids wind up there. Sorry, Mark.
No, not at all. And I just wanted to let the listeners know that we will have the information both about Drugstory Theater and our next topic, which is your books. And I'd like you to start by talking about your excellent book that is out right now called Outsmarting Anger. Anger clearly is an emotion that we have seen a lot of within the last several years, maybe more than, at least in my own lifetime. Maybe the intensity and the duration of this sense of anger for me has been something new that I haven't really experienced in our country. And I would love for you to talk to our listeners about Outsmarting Anger, Joe.
Yeah, I would be delighted. Let me preface it by saying there's nothing wrong with anger. It's what you do with it that matters. And right now, Mark, you and I are talking in a week where there has been the culmination of a remarkable piece, we hope, of justice in response to anger. And this is about George Floyd. Look what has happened. There has been an anger and outrage, and there has now been movement. Because anger is an emotion designed to change things. We get angry when we want somebody to do something different. Start doing something, stop doing something. It's the fight branch of fight or flight. But when I wrote the book, it was based on, again, this long experience that I've had with theater and medicine, and realized that there was a truth in what I'm about to say. When is the last time you got angry at someone who you really believed was treating you with respect?
Joe, I just want to say thank you so much for sharing those insights, which really are innovative and actionable within reach of all of us, I think, with some guidance. And I want also to tell listeners that this is the first part of a discussion that we'll be having with Dr. Joe Shrand. The second one will focus on his book, which will be out early in 2022, which is Unleashing the Power of Respect. Dr. Joe, thank you so much. And listeners, thank you for being here on this episode of When Science Speaks. And I hope we'll be back next time for the next episode of When Science Speaks.
This is When Science Speaks, a new web series profiling innovative and interesting people working in science and technical fields, from academia to industry to the nonprofit world. We explore how to be a powerhouse advocate for science and your research, how to advance your career in meaningful ways that make you happy, and how to push back on the ongoing assault on science and other related issues of interest happening in the world.